Hi, welcome. Today we're going to be doing a full back massage, and I'm going to be doing a massage for the lovely Emmy. And I'm going to go ahead and dive right in. So sometimes I will do a longer warm up without oil and do a lot of compressions. But I think I'm going to just go right in with my oil today. You can do a really nice warm up with some effleurage as well. And I'm definitely patient with myself. Like, I don't expect myself to get into a perfect flow, like right off the bat. So just really kind of finding my rhythm. And I tend to work on the slower side. I just feel like it comes more naturally for me. And I do find that one of the things that makes me feel the most tired is if I'm trying to just work with my arms and hands. So if I forget to like really work from my core, I'm even working from my feet, then can get kind of tired. And also, like, my movements can start to feel kind of choppy if I forget to be more whole body focused, my approach. I'm just gently working this connective tissue a little bit. I'm working the soft tissue. And especially as I work my way along this erector spinae, using a nice firm pressure. I would say one of the least satisfying feelings is there's so much connective tissue around the sacrum that if you stop like above the iliac crest on your way down, it's just not nearly as satisfying as if you really go into the hips a little bit. Of course, you want to make sure that you're communicating with your client, that they're comfortable. Especially if I'm working on someone that's draped, I like to go under the sheet a little bit if my client's comfortable with it, because it just feels way better. And I did forget to mention that I don't really work with jewelry on ever, but I'm pregnant and so my fingers are swollen. I'm not able to get my ring off right now. In case you're wondering why I'm wearing jewelry. I also like to, as I work my way over that iliac crest, I like to go a little bit deeper. So just starting to gradually work a little deeper. And it's definitely kind of an art to work around the sacrum and work on this thicker connective tissue, because it can be a little bit bony too. So you just need to definitely pay attention. And I like to work my way around the iliac crest, kind of work that tissue from a different angle. And I'm gonna go ahead and grab a little more oil. When I do a full back massage, I try to, or I naturally use my forearms and my elbows more than 50%, I'd say. So and I'm just kind of always asking myself, like, if I'm working on someone that has a tighter lower back, like, I'm just conscious of how to place the arm. There's all kinds of things you can do to just make doing effective work easier. I'm just opening up this side body a little bit. I actually find it to be a lot more challenging working on smaller framed people. You have to use quite a bit more restraint, especially when you are wanting to do deep tissue, just because smaller framed people are bonier. And I really like working along this iliac crest with my forearm. Just a really nice way to work. And I'm gonna go ahead and do a few compressions in this medius. And I'll often start my massages this way. But it just depends on how much time I have. And today my routine's a little shorter. Just always finding interesting ways to tie different techniques together. I really like to, using my right hand, I like to work on top of the scapula a little bit too. Just start to warm up that rotator cuff. So on, a really broad stroke like that allows you to work the more superficial muscles. And then as I kind of start to work my way up with the opposite forearm, I can start working the deeper muscles a little bit more. And the superficial ones. So anytime that I want to work on the traps a little bit more, I want to make sure that they're nice and open. So I'm going to go ahead and change that arm position a little bit. And sometimes just a simple thing like what I'm doing right now, it can really encourage just a nice small release, at least in that area, kind of less holding. It's important to keep in mind that if somebody's complaining of upper back pain, it's usually referral pain. So it often means that the rotator cuffs are tight or the pectorals are tight. So just always thinking broadly when someone comes to me with an issue. Always finding some really nice trigger points around that scapula. And never like dissecting the massage. So even if I'm moving from working with my forearms to work with my hands. I'm keeping as much contact as I can. So always when I'm working closer to the table, I'm widening my stance. So I'm not putting a lot of pressure on my low back. Because I didn't do any compressions in this medius to warm up, because I'm using my elbow, you might assume I'm using a lot of pressure, but I'm really not. So just practicing that restraint so as not to go too deep too fast. Sometimes that's the hardest part of doing deep tissue, is just finding that, walking the line of the right amount or too much. And just working my way on top of that scapula a little bit. And I usually it's easier for me to find kind of a smoother flow when I'm working with my right hand, because I'm right-handed, but it just depends on the day. Especially if I feel like someone's just kind of holding their body like up from the table. Like if they're really tense, I'll just do something to kind of encourage them to just let go a little bit before I try any deeper work. And also, if you're working on a new person that wants to, sign on for more massages with you, and you find that they have a lot of trigger points and just if it feels really contracted in here, don't assume that you just need to spend like the whole massage on your next visit there. Like I would think more like, pectoral major, rotator cuff. That would be kind of my focus. Not that you don't want to work on the lower and upper traps. That's really important. Elevator scap. But it's just not enough to bring about like lasting relief. I'm going to go ahead and end with just a really simple myofascial release technique. While I do this, I want to thank a few of our patrons. I'd like to thank Josue M, Dustin T, and Zachariah P. Thank you guys so much for your support. And just stacking my hands so that it's a little easier. Get a firmer grip. Always spending a little extra time this upper back. And just taking my hands off nice and slow. And that's all for today. Thank you for joining us today, guys. If you enjoyed today's video, you should check out our Patreon page where you'll find some really great content exclusive to there. I look forward to seeing you there.
If you enjoy these videos, please join us at psychetruthpatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit psychetruthpatrons.com.